An abdominoplasty or tummy tuck is done for excess skin on the abdomen. Generally, most people have excess skin and some fatty tissue. If you don't have any excess skin, you're probably a better candidate for liposuction, but it sort of depends on how much you can pinch and how much excess skin you have, usually after childbearing or changes in weight. So an abdominoplasty is done through a long lower abdominal incision. I tell everybody, the longer the incision, the more skin I can excise. When you do a full abdominoplasty, you lift everything up to the belly button. Then you cut around the belly button. Your belly button's still connected on the inside, but you're going to go ahead and lift everything all the way up to the rib cage. We often tighten the muscles while we're there. After having kids, you get what we call diastasis, separation of the muscle that gives you that pooch you can't get rid of. Tightening the muscles really gives you the effect of what you do sucking in. We pull the skin down like a window shade, and generally on a full abdominoplasty, I can get quite a bit of skin off, at least this much, sometimes this much. From your pubic hair to your belly button, that skin mostly goes away. Stretch marks will get pulled down. Sometimes I can excise almost all your stretch marks. Everything's pulled down tightly, kind of with you in a flexed position. The belly button is brought out through a new incision. Drains are placed. You'll feel tight. You'll feel like you can't stand up for a couple days straight. And you'll have a scar around the belly button and underneath. The drains generally stay in about a week. I put 2 in. 1 stays in about 2 days. 1 stays in a week. A lower abdominoplasty, you really stop at the belly button, so it's really for people who have localized tissue just on the lower abdomen and not a lot of muscle separation on the upper abdomen. I find more people need a full abdominoplasty than a lower abdominoplasty. As far as the abdominoplasty though, it is a bigger procedure. There are more risks and complications, and we discuss that at length. Average time off work is 2 weeks, and even then I tell people, just realize you're going to be tired, you're going to get worn out more frequently for those first few weeks. 6 to 8 weeks to be up to full speed. As far as activity, it's a gradual increase in activity. Golden rule, if it hurts, don't do it. For 2 or 3 days, you're really pretty much doing nothing. Give you good pain pills, good muscle relaxants. Try to keep you as comfortable as we can. And then gradually increase your activity after that. No abdominal exercises when we placate that muscle. I don't want you doing any abs for 3 or 4 months. But satisfaction-wise, it is a long scar, but the contour of your abdomen will be so much better. Flatten your clothes, and there are a lot of people after children that no matter how thin they are, they can't get their muscles tight again, and they can't get rid of that extra skin. There's no exercises that are going to get rid of or tighten your skin for you. If you have extra skin, you probably need a tummy tuck.